Welcome, Chapter 14, Access Control, Laws, Policies, and Standards. Learning Objectives and Key Concepts. Learning Objective. Develop an access control policy framework consisting of best practices, policies, standards, and procedures, and guidelines to mitigate unauthorized access. Key Concepts. Regulatory laws concerning unauthorized access control, security policies, and best practices, organizations-wide authorizations and access control policy, standards, procedures, and guidelines. U.S. compliance laws and regulations. Compliances ensure that organizations implement more secure business practices. Secure business practices help organizations avoid costs associated with security lapses, can enhance customer confidence. Adhering to requirements is usually cost and time consuming. Gramm-Leach-Bliley Act. The Financial Modernization Act of 1999 protects personal financial information held by financial institutions. Requirements. Requires companies to develop, implement, and maintain a written information security program that contains administrative, technical, and physical safeguards. The GLB and access control. Organizations define who can access data and for how long. Access to sensitive data must be logged to provide accountability. The Healthcare Portability and Accountability Act of 1996, Hipaa. Title I. Protects health insurance companies for workers and their families if they are charged, changed, or lost jobs. Title II. Also known as the Administrative Simplification Provision, requires establishment of a national standard for electronic healthcare transactions and national identifiers for providers, health insurance plans, and employers. HIPAA 2 rules, privacy rule, transactions and codes, set rules, unique identifier standard rules, security rules, enforcement rules. Privacy rules regulates the use and disclosure of protected information held by covered entities. Establishes regulations for the use and disclosure of protected health information. HIPAA information may only be disclosed to the individual with 30 days of request upon written permission of the individual when required by law to facilitate treatment, payment, or healthcare operations. Transactions and code set rules requires a common standard for transfer of health information between healthcare providers and organizations that process payment for these services. With HIPAA, all payees must accept a common standard for electronic data. Unique Identifier Standard Rule handles the creation and use of unique identifiers for providers, health plans, employers, and patients. Employer identifier is based on the IRS assigned employee identification number. Patient identifier is a standard, unique way of identifying patients. The National Provider Identity was originally developed for the Medicare system. Health plan identifiers are a 9-digit number used to check digit for developed by HIPAA. Security rule covers electronic protection, health information. Set out 3 layers of security safeguards: administrative, physical, and technical. Each rule has a standard and implementation specifications. Enforcement rule, created by the Department of Health and Human Services. Rule that details the basis and procedures for imposing civil monetary penalties on coverage entities. Unification and patchwork of existing rules and regulations that govern the enforcement of different parts of HIPAA. Brings together and extends all other rules. Requires Health and Human Services to try to resolve compliance issues and inform a manner before restoring monetary penalties. Sarbanes-Oxley or SOX Act protects investors by requiring accuracy and reliability in corporate disclosures. Create new standards for corporate accountability. Create new penalties for acts of undoing, both civil and criminal. Changes how corporate boards and executives must exchange information and work with corporate auditors. Specifies new financial reporting requirements. Requires all financial reporting to be included internal control reports. Auditing firms and also require to attest to the accuracy of the assessment. The Sarbanes-Oxley Act. Title I, Public Company Accounting Oversight Board. Title II, Auditor Independence. Title III, Corporate Responsibility. Title IV, Enhanced Financial Disclosure. Title V, Analyst Conflicts of Interest. Title VI, Commission Resources and Authority. Title VII, Studies and Reports. Title VIII, Corporate and Criminal Fraud Accountability. Title IX, White Collar Crime Penalty Enhancement. Title X, Corporate Tax Returns. Title XI, Corporate Fraud Accountability. Family Education and Privacy Act, FERPA. Protects the privacy and ensures accuracy of student education records. Right to inspect and review, right to correct records, and parental written permission required. Items exempt from FERPA. Private note made by faculty or staff for the purpose of assisting memory. Law enforcement records, medical records. Statistical data does not contain personal identification information. Pre-graded material before the final grade is determined to be by the faculty. Direct information, non-directory information. FERPA directory information, name, address, telephone number, email address, dates of attendance, degree earned, enrollment status, field of study. Communication of Assistance of Law Enforcement. Requires telecommunication carriers and equipment makers used by telecommunication industry to facilitate electronic surveillance activities of law enforcement agencies. Firms subject to the Communication Assistance for Law Enforcement Act must cooperate with legitimate law enforcement requests. Children's Internet Protection Act, federal law enacted in 2000 that addresses Internet access in public schools and libraries. School districts or libraries' participation in the E-rated program must comply with SIPA. Must block obscene pictures or child pornography on computers that minors can access. Requirements: block obscene pictures of child pornography on computers that minors can access. Adopt a policy addressing the following: access by minors of inappropriate material, the safety and security of minors when using electronic communication such as email, unauthorized access, including hacking and other unlawful activities by minors, unauthorized disclosure of personal information regarding minors, restricting minors' access to material that is harmful to them. Food and Drug Administration, FDA regulations. Title 21 CFR Part 11 of Code of Federal Regulations deals with FDA guidelines on electronic required and signatures. Systems access limited to authorized individuals. Use of operational system checks. Use of authority checks. Use of device checks. Educational and task training. Control for documentation in open and closed systems. North America Electric Reliability Council handles the regulation of energy and utility companies, ensures that North America energy network is secure, adequate, and reliable, requires physical protective measures for critical infrastructures. Electronic security guidelines include procedures meant to provide protective insurance measures for access. Must do background checks for employees and contractors. Must provide training for anyone with access to energy or utility infrastructure. Homeland Security Presidential Directive 12. Standardization of security identification credentials for government employees. Part 1 covers common identification, securities, and privacy requirements. Part 2 deals with uniformity and portability identification. Americans with Disabilities Act includes provisions for ensuring everyone has equal access to public accommodations regarding of disability. Section 508 of ADA governs accessibility to websites run by federal government. Access control, security, and best practices, private sector enterprise organization. Best practices cover the policies, standards, procedures, and guidelines for a given topic. Defining an authorization policy. Authorization policies defines how an organization will assign and enforce access control rights. Written policies define the high-level strategy for access control, security, and identify the organization's security goal and compliance obligation. Access control facilities. Appropriate entry system access control. Secondary locks, equipment, and storage in cabinets within the facility. Prevention of social engineering. Access control systems. Access control. Limit access to those employees who have a legitimate need for resources. Describe a strong password policy. Access control for applications. Standard testing procedures for any third-party application installed in the environment. The authorization policy should dictate that all access controls within application be examined and tested for security. Limited application access. Many organizations seek to avoid operational issues by running applications under the administrative account. Access control for data. Specify what data should be encrypted. Depends on the organization's regulation, compliance need for other factors, provides criteria for encryption of data. Enforce the principles of the lowest possible access. States that if read access is sufficient for an employee to perform necessary tasks, the employee should not be granted read-write access. Access control for remote users. Provide remote access only to those employees who have legitimate need to work off-site. Grant access to those VPNs through two-stage authentication process that include both a strong password and a token device. Outline specific guidelines that your authorization policy and acceptance activity will connect to the VPN. Public sector, federal, state, and county and city government. Conduct periodic risk assessment. Implement policies and procedures based on the most recent assessment. Create plans for security and network systems and other resources. Conduct employees and contractor training. Test periodically to ensure that policies and procedures design low risk. Create processes to address shortcomings in security policies and procedures. Implement policies by detecting and reporting and responding to them. Critical infrastructures include utilities and transportation. Critical infrastructure provides essential service for modern life. Includes water supplies, roads, rail, transportation networks, sewers, engineering, energy services, communication, and government facilities. Critical infrastructures that fall under the public or private sector. Supervisory control and data acquisition, process control systems. Monitor and control telecommunication, water and waste control, energy and transportation and utility. At a point of risk for the utilities that use them, strong access controls require physical security on a collection point. Encrypted communications between collection points and controllers in the central hub. Two-way authentication between remote points and the central controller. Easily managed users' rights from removing or modifying users. Segregation of the SCADA system from the rest of the network operation. Threats and vulnerabilities. It is imperative to conduct a threat and vulnerability assessment for critical infrastructures. Understand interdependencies is essential to secure the most critical systems. Identifying a single point vulnerability is essential to risk mitigation. One of the first steps you must take when analyzing risk and developing a mitigation plan is to identify which assessments are most critical. Redundancy for critical systems is vital to risk mitigation. Infrastructure design must avoid single points of failure. IT security policy framework. Challenges for IT department. Establish and continually update access control policies in the evolving technology and business environment. Factors to consider when building an IT security policy framework. Size of the organization. Type of information used. Information in which the organization exists. Framework must address both logically and physically security and human aspect of security. Framework. Install antivirus and intrusion protection. Don't forget policies and policy monitors. Firewall, mainframes. IT security policies framework. Policy. Document that describes the specific requirement of rules must be met. Standards. A collection of requirements that must be met by anyone who performs a given task or works on a specific system. A set of suggestions and best practices for meeting standards and policies. Procedures, specific steps to be taken to achieve desired results. What policies are needed for access control? Acceptable use policy describes what tasks can and cannot be performed using the organization's computer resources. Password policies describes the organization's requirements for strong password creation and maintenance. Account management policy describes how new accounts can be created and secured and old accounts deleted. Remote access policies define standards for connecting the organization's networks off-site. What standards are needed to support these policies? User account standard describes the user's account on specific systems and networks. Identification standards describes how users' intrusion detection systems are defined. Remote access standards describes tools used to implement remote access policies. Application development standards describe security precautions that must be designed into the application developed in-house. What procedures are needed to implement these policies? 1. User fills out an access request form. 2. IT receives the request form and passes it to the correct authority for approval. 3. Form is reviewed and authorization is granted or denied. 4. IT implements the access rights modification. After sign-off, IT files the request in the user's file and verified access provided information audit. What guidelines are needed for department and end users? Example of departmental guidelines. Department heads and managers should review access control systems periodically, but not less than the annual. User accounts should be disabled after 30 days of inactivity. Examples of individual guidelines. Individuals should be periodically reviewed access control policies, standard procedures, and guidelines. Individuals should not store critical information in their email accounts. Users should not write down their passwords or base them on personal identifiable information. Case study and examples. Private sector. Acme, a medical device company, needed to step up procedures and policies to enforce compliance with Hipaa and SOX. Had Hipaa experience, SOX was new to them. Expanded and reused many Hipaa's policies, gained SOX compliance as well. Public sector. Los Angeles County Department of Health Service distributed monthly health alerts to hospitals and others must be timely secure. Implemented a role-based access control messaging system with two-way authentication system. Washington's critical infrastructure. Washington's company developing a seaport gate control system for Florida deepwater seaports. Access control to port facilities is a manual process, time-consuming and subject to human error. Implement a new smart card system, contains information, credentials, and photographs and fingerprints. Summary. Regulatory laws concerning unauthorized access control, security policies, and best practices. Organizational-wide authorization and access policies. Access control policy standards, procedures, and guidelines.